All right, a lot of ground to cover today. It's Friday, October the 9th. We're not headed into the weekend the way we would like to be, with a fairly significant upswing in the number of cases. As of the time of this recording, we are now at 8 active. It was 2 earlier in the week, went to 4, went to 8. There's a possibility that it could spread some more. So in the interest of providing as much information as we can, you get 3 for the price of 1 today. We're going to visit with the mayor, with Dr. Sanders, and with the city manager to get reaction and what we ought to know going into the weekend from their different perspectives. Again, these cases appear to be the effects of behaviors from last weekend, according to the documents that we were sent announcing this. The health alert level is still at 3. They aren't looking at taking it beyond that, although that's certainly a possibility if it continues to spread around. It also sounds like the spread is occurring privately and not in community spaces. It's within some specific groups. So we'll get into that here. Quick reminder, again, the daily briefings are weekdays 1, 5, and 8 p.m. on the radio and uploaded to youtube.com/Cordova TV. So let's start our roundtable here. Mayor Koplin, we haven't talked in a while, and things are, well, not as they were last time we spoke. So what's your reaction to hearing these numbers? Is it something that was expected for fall or winter, or is it more of a surprise?
I feel like it's more of a surprise. Not a surprise that we would have an uptick like this, or that, some relaxed behaviors might result in some positive cases. It happens when it happens. And, every time things start to heat up a little bit, of course, it's very concerning.
Okay, so in response, we're going into a weekend here. Given what has occurred, what would you like people to know as we move forward?
Well, first of all, and we've talked about this throughout, the communications is so important. And, as mayor, I kind of, a lot of the communications come to me when people hear the rumors, and which generally exaggerates the actual, actual character. And so rumor control has been a lot of my effort the last couple of days. 2 days ago, 10 new cases today, and such store is the cause of the spread, and so-and-so's whatever. And it turns out none of that's grounded. And you hear a lot of so-and-so's infected, so-and-so is, done this or that. And, a lot of plausibility. Somebody travels, and so under an abundance of caution, they put a note on their apartment door saying, "I'm in quarantine." That doesn't mean that they're one of the cases that just tested positive, and that the business they work for was the starting point. And so we need to be careful about the sources of information, and again, rely on the incident management team and our medical team's contract tracing to really give us the clear picture.
Okay, well, we certainly wish you a safe weekend. Anything else for us?
Repeat, the contact tracing does look like it's surfaced a couple of events that are contributing to our current uptick, and we may not have seen the end of it. And I just need to remind people there's the 3 W's and the 3 C's that we keep hearing. So wear your mask, watch your distance, wash your hands, avoid crowded places and close contact settings, and confined or enclosed spaces. We are having the Coast Guard City Appreciation this afternoon. We specifically worked with the doctor and internally to follow protocols to have a very small group meeting indoors that's well distanced, having the main appreciation at 6 o'clock upstairs at the Cordova Center outside, so members of the public can participate outdoors, wear a mask, and enjoy the event, again, without adding risk. So those are just the kind of behaviors that have been working great for us, and we need to continue following.
All right. Thanks much, Mayor. We appreciate it. Dr. Sanders, we want to move to you here. This growth in cases is not unexpected to you. We know we talked about this yesterday, and you said it was likely there were going to be more because of the nature of the genesis of these cases. So, what would you like folks to know going into the weekend about being safe and not making things any worse?
Yeah, I think it's very important for people to recognize that these cases spread when people that have COVID are indoors with other people and not wearing masks. So if we want to flatten the curve and get this to go away, I would encourage people to not spend the weekend indoors with non-household members.
Okay, and the document said that these cases appear to be the effects of behaviors from the last weekend. Like you said, the state documents have said that the primary way it's moving around is at gathering. So, and the documents also said, the stuff I got emailed from PR today said it sounds like the spread is occurring privately and not in community spaces. So, all of that just sort of leads, I guess, still to the same thing that you just said.
Yeah, we have seen coronavirus. It's sneaky. We see a lot of asymptomatic spread. We see people spreading with very mild symptoms. Right now, we have several cases in our community that are symptomatic. So that symptomatic spreading with mild cough, we definitely see increased transmission during that time. So it's really important for people to keep distance and wash their hands. I think that Cordova can do this. I think we can flatten the curve and see these cases decrease, but it's going to require people being very cautious. I know it's been difficult because this pandemic has gone on for a long time. People are having a hard time continuing to wear masks consistently when they're socializing. It really is an excellent way to decrease transmission, and I'm hopeful that everybody can just stick with us and help us get through this period.
Okay, so really focus on that concept of the bubbles. It sounds like, don't relax your defenses when you're around people that are not in your household, essentially.
Yes. The one other thing I'd like to add is we are following state and CDC guidance. The state is doing our contact tracing. We have been in close contact with our public health nurse as well as the state epidemiologist to make sure that we are identifying any early outbreak locations and identifying those people. We are encouraging everybody to follow the quarantine guidance. So if you're identified as a close contact, please follow the quarantine guidance. If the public health nurse calls you, we want you to quarantine for 14 days. There is not a get out of quarantine by testing. And I know that was said earlier, but it's really an important piece right now. We're getting a lot of calls about people needing a test so that they can get out of quarantine, and that just is not an option per state guidelines.
Okay. Yeah, I'll go over that again when we wrap up, but thank you very much for reinforcing it. Anything else?
I don't think so. Thank you for including me and helping get the message out. I know people are nervous. We've been watching for this. We knew that COVID was going to get to our community. We've done very well this summer, and I expect that we'll continue to do well.
All right. Thank you, Doctor. Sure appreciate your time. And City Manager Helen Howarth, will go to you. Your reaction to seeing these numbers start to spike up here?
I am dismayed. Oh. We have done so well all summer long through all those risky time periods that we thought would result in cases. Now here we are in fall when most of the fishermen have left town, all of the processors have closed up, and we have community members that have let their guard down and are not paying attention and have participated in risky behaviors, resulting in an increase in case count and a significant increase in case count that might result in all of the hard-earned gains that we've done, might result in closure of city facilities, from the pool to the Darky Rec Center to City Hall to Library Museum to, the closure of the schools.
Mm-hmm. Now, it's just a possibility at that point, not anything that's
Yeah, no, and I think I really want people to be aware of the fact that if we keep on this trajectory, and I hope that everyone will really start paying attention, wear your mask, social distance, don't participate in large group activities. If people will do that for the next week or so, we might be able to flatten the curve. But if we don't, and we see the kinds of numbers we've had this week and an increasing number of cases, we will have to take action to protect the community. And that will result in the closure of facilities and possibly the closure of our schools to in-person learning. We don't want to go there. So people, please follow the rules. It's so important. I cannot emphasize that enough.
So is that pretty much what you'd like folks to know then going into the weekend is again knowing and following these strategies? Yes. And yes. We have to pay attention. I know for many people, they may not believe that COVID is a big deal. And perhaps for them it isn't. Maybe they'll have mild symptoms. Maybe they have a cold. But there are people in our community that are vulnerable. And we have to be aware of the fact that this disease spreads rapidly. And when it does spread, it impacts people universally, but in different ways. And we can't allow our community to fall down the rabbit hole that other communities are in where we have a high case count. We can't afford to do that. Yeah, well, because, all of us are in kind of close quarters in a sense. So, okay, well, thank you. And I agree it's a message that needs to be out there. Something that we've said throughout all of the folks in leadership, and it's what we believe at the stations, is that that personal management and personal containment efforts are the key to success. It's not mandates, and it's not the government saying you can and can't. It's people being willing to take it, to take responsibility for themselves and have a concern for others in the community. Yes. And for me as city manager, the hardest thing to see is, and it's been hard. It's been so hard for all of us. We've been doing this a long time, and it's easy to get a little complacent and say, "Oh, we haven't had a case for weeks," but that is exactly when people let their guard down. That's exactly when the virus appears. It is in our community. It's just not spreading until people don't wear masks, go hang out together, drink out of the same bottles, share whatever. If we do those sorts of things, we will have cases, and that's just reality. And we do. And now we need to stop it. We need to stop the spread. So over the weekend, please, all of you, if you have planned parties, change your activities for the weekend. Hunker down a little bit, wear a mask, please. Wash your hands, do all the things you're supposed to do, and let's get this number, this increasing cases down. Let's see the trajectory go the other direction. So with that, I will cross my fingers and hope that this weekend does not see a further increase, or we will see us as a city and as a community having to make changes in our ability to access certain things. So let's all do our part. All right, that'll wrap up our roundtable today. Again, there's enough spread that we thought it might be good to just kind of hear from a variety of folks in different positions. Mayor Koplin, Dr. Sanders, City Manager Helen Howarth there most recently, who brings up a good point. It's interesting. There was so much concern, you'll remember early on, about the fishing season being the thing that needed to be reined in, and whether we were going to have visitors come in, and doggone it if we didn't do it to ourselves in terms of one of the most significant upticks in cases. But again, Dr. Sanders says it still feels manageable at this point. They're not talking about raising the alert level beyond yellow. No definitive talk about closing facilities, but as Helen said, that's on the table if we aren't careful. So, and then a reminder about what the mayor said with the rumor mill and trying to avoid that as much as possible, because of course that doesn't help. This gets everybody on each other's case. So, A lot of interesting perspectives from folks who have been working very hard to keep our curve flat. We hope the community will join in doing that, in trying to prevent the spread, and we will continue to do our best to keep you informed with the daily briefings in the 1, 5, and 8 p.m. hours on the radio, and then they always get uploaded to youtube.com/Cordova TV. Back to regular programming now on KLAM and KCDV. Have a good and safe and well thought out weekend.